Hi, my name is Diana Poon, and we will be talking about SMART goals and how to help your student to create these goals so that there's success for both you and your student in this preceptorship. Creating SMART goals is really to help you as the preceptor to help the student meet their clinical objectives that are set forth in the curriculum by their school. It also helps promote communication between you and the student, allowing you to understand the foundation of what they've already learned and where they want to grow, and also really tailoring each preceptorship so that you're understanding if they're a first year or second year and what they're currently studying in their classes and really apply that in their preceptorship. Most importantly, I feel that the SMART goals allows for a really safe space between the preceptee and the preceptor for constructive critique, feedback, and also praise and encouragement to show them how much they've grown in a few weeks or even months in their learning to become a nurse practitioner or physician's assistant. So what are SMART goals? They are specific, measurable, attainable, relevant, and time-based. So what does that mean? When you're setting up the goals with your student, you want it to be about a specific either diagnosis or a learning issue or skill that they want to attain. It is supposed to be measurable, meaning a time or specific number of charts, for instance, or patients that they will use as the measurable goal. It is attainable within a certain time period. It's relevant. Hopefully all of it is relevant because we are precepting in the workforce right now. And time-based, and how will this goal be achieved? So I wanted to break down these SMART goals into both long-term and short-term discussions with the student. Long-term really being thinking about what they want to achieve over the entire preceptorship or maybe just in a month or two versus short within like a week or a few weeks. So instead of just a generic way of saying, I want to be a better provider or I want to be a better nurse practitioner by the end of the preceptorship, it's really honing in on key elements that they want to work on. So examples of these would be, in the next 3 months, I'll practice performing comprehensive physical examinations that are age-specific to identify any concerns that the patient has. Or at the end of the preceptorship in 3 months, I'll be able to come up with at least 3 differential diagnoses for each patient. Again, another example is in 2 months, so time based, I'll be able to write a comprehensive H&P by asking pertinent positive and negatives, review systems, and practicing writing 1 comprehensive H&P every week. So you can see in these 3 examples, there is a time component, whether that's 3 months or 2 months, or the end of the preceptorship. There's a specific skill that they want to learn, comprehensive exams, differentials, writing an H&P. It is time sensitive, it is relevant. And you can see how this is much more accurate, a much more detailed example to help the student to write down exactly what do they want to learn, and to make them actually think about it, because a lot of times they may just want to be a sponge and soak everything up, which is great, but they also need to be able to pinpoint what areas do they want to learn and work on. And bringing that down to now short term, maybe in the next few weeks or for the next 2 shifts, whatever it may be, just to help them make small steps towards that big long-term goal. There's no way to really jump from 0 to 100, and this SMART goal, short-term goal, really helps you to make those steps. It helps the preceptor to know what to help the student work on, and of course the student to learn and not feel so overwhelmed and burdened by all of the learning that they will want to do. And so again, instead of just something basics or simple as I want to learn more about the patients, they can make SMART goals. Examples would be, for the next 2 weeks, I will focus on reviewing the labs of 1 patient and identifying any abnormal labs and explain why they are abnormal for this particular patient. So that's, helping them to talk about the pathophysiology, the labs, and honing that in and connecting that with the diagnosis. And this goal could be the same goal for the next 3-4 weeks. I mean, it is definitely something that they will continue to work on, but perhaps maybe in 1 week they can do it for 1 patient, and the next week they can do it for 2 patients. Another example is I want to be able to precisely present to my preceptor on 2 patients. So whether that's a one-liner or a quick, brief synopsis of the patient, that will be an example of what the preceptee can work on. Another example is by next week, I'll be able to write progress notes on 2 patients. So again, time specific and specific in where and what area they want to learn and grow in. So how do you start with this goal setting? Because it is pretty hard to really think about the specifics. A really quick and effective way is just to go over the curriculum of the school. They have normally really nice layout of what they want the student to learn. You can talk to the student about what is it that they have learned in the past or feel like they're weak in. First, if they didn't have a lot of experience with comprehensive examinations or they never really were able to write a note. Those are the areas that you may want to focus on. You can ask the student what they want to learn, asking the broad questions, and also just think about different elements that would help them grow. Not just knowledge base, but skills and also professional growth. I feel like that is something that nurse practitioners or PAs, we do naturally sometimes and not think that the student needs to learn that as well. How to engage with other providers, how to close the loop with PCPs and pediatricians, or how to also just, coordinate the coordination piece with other providers from other specialties, connecting radiology. For instance, I work in neurosurgery, so radiology, neuro-oncology, endocrinology, all of these things that would help a student to learn holistically and comprehensively how to be an APP. So again, the key element of setting up SMART goals is to help give great constructive feedback to your student. Students probably are really scared when they feel like there's an end feedback at the end of the year, but not so daunting if you keep creating times and spaces for feedback. It allows the students to have a safe space to ask questions and to just maybe tweak areas that they need to grow in and have been doing perhaps wrong. We've asked many students, and you'll see the segment in another video of what was the most helpful for the students. And a lot of them said they really enjoyed goals and being able to feel challenged. And so this goal setting is pushing them a little bit out of their comfort zone, but giving them a space where they can fall back on and say, okay, this is something I want to work on, and this is how I will get there. So you can review the goals throughout the preceptorship and identify places to improve, and you can adjust the SMART goals accordingly. So instead of, maybe work on the same goals for 3 weeks because it just hasn't clicked in yet, and that's okay. And because you're creating these goals with your students, you can give them resources and materials to achieve these goals. And that's, part of the SMART goal component is that you're not just letting the student figure this out on your own. You're there the whole way, giving them resources and encouragement. They need the encouragement to feel like they're doing something right. And this will help them because at the end of the preceptorship, they can go back and say, look at all the goals that I've achieved over 2 months or 1 week. And again, at the end of all this, it's not just about the preceptee and the student. It's about your praise too and how much you've done to grow another student, grow another future APP to be an amazing provider. So thank you for your time, and if you have any feedback or comments on how to improve or things that you felt were really helpful, please email us at appstudentplacement@stanfordchildrens.org. Thank you so much.